Hello, my friends. There are certain truths about intimate health that many men go through their entire lives without hearing. Truths that might bring a slight flush to your cheeks, but I promise they have the power to transform how you approach intimacy, trust, and your own well-being. Well, I'm Dr. Nerea Wolf, urologist and pelvic surgeon, and if you ever face questions or concerns about your urological health, stay with us. We're here to help you understand your body with clarity and comfort. Today, I want to have a gentle, honest conversation about something that affects relationships at every stage of life. Before we begin, I'd love to invite you to like this video, subscribe to the channel, and share in the comments where you're watching from. Knowing that our community spans across cities, towns, and quiet places brings warmth to my heart. Now let's open our hearts to this important discussion. Here's a truth that often remains hidden from many men as they age. Intimacy doesn't retire. Passion has no expiration date. Yet I see far too many men surrendering to the belief that they're too old for deep connection, or feeling that their bodies are somehow betraying them. Let's gently unpack this myth today. The challenges you might experience in intimate moments aren't always about age. Very often, they're connected to small, manageable habits, changes you can embrace right now, with kindness toward yourself. Today, we're going to explore one of these intimate topics that men have trusted me with time and time again. These are practices that may feel taboo to discuss, but they open doors to greater trust, deeper pleasure, and genuinely connected experiences. In my years as both a urologist and someone who helps men in their 50s, 60s, 70s, and beyond restore confidence in their health and intimate lives, I've witnessed how beautifully science aligns with the soul. When men truly understand how the body works, how biology intertwines with emotions and daily life, they make choices rooted in wisdom. They reconnect with their partners in ways that feel like rediscovering a blessing they thought was lost forever. So today, with gentleness and clarity, I want to guide you through 5 key truths and common mistakes men make about intimacy, fluids, and connection. Each one builds upon the last, like steps along a path toward inner peace. Stay with me, because the first one might surprise your heart more than you expect. Mistake number 5, believing that vaginal fluids are unclean. Let's start here, my friends, because this is the root of so much quiet embarrassment and emotional pain. Vaginal fluids are not ordinary moisture. They're a masterpiece crafted by the divine wisdom of the human body. Biologically, these fluids come from 3 main sources. Bartholin's glands, which provide silky fluid that gently reduces friction. Skene's glands, sometimes called the female prostate, which offer deeper lubrication as arousal flourishes. The cervix, which secretes protective mucus that nourishes and balances the vaginal environment. These fluids are mostly water, enriched with amino acids, enzymes, minerals, and lactic acid. Gifts designed to protect sensitive tissues, fight off infections, and make intimate connection a safe and joyful dance. Emotionally, when a man withdraws from these fluids or judges them, he plants seeds of shame in a woman's heart. It erodes trust. It makes intimacy feel fragile and unsafe. So here's the gentle shift I'm inviting you to make. Don't view these fluids as something off-putting. See them as a sign of love from the body, a signal that connection is possible, safe, and blessed. In my practice, I've seen how this perspective heals old wounds. It allows couples to embrace each other fully, body and soul. Mistake number 4, ignoring taste and scent. This is the question men whisper to me most often in confidence. What about the taste or smell? Let the biological truth bring you peace. Fluids vary naturally. Diet, hydration, hormones, stress, and even medications shape their essence. Foods like pineapple, citrus, and plenty of water often bring a fresher, lighter note. Garlic, onions, alcohol, or coffee can add a stronger edge. Hormonally, around ovulation, fluids tend to be neutral and mild. Near menstruation, there may be a faint, metallic whisper. After menopause, flow may decrease or carry a slightly acidic tone. Emotionally, what truly matters is this: variation is the beauty of our humanity. Just as no 2 men carry the same scent after a day's work, no 2 women taste exactly alike. This is a reflection of our unique souls. Practically, if there's a sudden unpleasant change accompanied by discomfort, it's often a simple, treatable imbalance, like bacterial vaginosis or a yeast infection, a gentle nudge toward a doctor, not a barrier to love. The mistake is turning natural flow into criticism. Gentlemen, your gentle acceptance is more arousing than any judgment. It invites her soul to open fully. Mistake number 3, neglecting safety. Now let's answer the question from the heart. Is it safe to ingest vaginal fluids? For healthy couples walking this path together, the compassionate answer is yes. These fluids are essentially water, enzymes, and protective compounds, biologically gentler than a shared kiss or sip from a glass. But with a healer's empathy, here's the caution we must carry. Fluids can carry sexually transmitted infections, just like semen or blood. Chlamydia, gonorrhea, herpes, syphilis, trichomoniasis, HIV. The risk increases if either partner has an active infection, especially if the receiving partner has sores in the mouth, bleeding gums, or ulcers. Biologically, risk is part of our mortal journey. Emotionally, honesty is our sacred guardian. It builds bridges of trust. Practically, the path is clear. Know your status, test together, and use barriers wisely in new relationships. The mistake is assuming no symptoms means no shadow. True intimacy flourishes in trust and transparent hearts. Mistake number 2, remaining silent out of fear of embarrassment. In my consultations, I've seen couples drift apart, not from illness, but from unspoken fears. A change in scent, a question about safety, curiosity about oral intimacy. If left silent, these grow into heavy shame. Biologically, our bodies evolve after menopause, after illness, even with dietary changes. Fluids shift too. Emotionally, hidden fears make a partner feel rejected without understanding. It breeds quiet sorrow. Practically, small things remain unhealed. Intimacy becomes awkward, and hearts distance. The mistake is this heavy silence. The solution, my friends? Communication woven with gentleness, curiosity, and deep respect, like a shared prayer between souls. Mistake number 1, forgetting the emotional power of acceptance. This, my dear ones, is the greatest lesson from my years guiding hearts. When a man embraces his partner completely, including her fluids, he whispers to her soul, "I accept all of you. I trust you. I love every sacred part of you." Biologically, this acceptance allows her to relax deeply, increasing arousal and natural lubrication as the body responds to emotional safety. Emotionally, it heals years of quiet shame women have carried about their bodies, like salve on an old wound. Practically, it transforms intimacy into pure joy, playful, fearless, alive with spirit. The biggest mistake men make is viewing intimacy as mere mechanics. In truth, the greatest catalyst for passion you'll ever know is your partner feeling completely, divinely accepted. How to weave this wisdom into your life today. Here's a simple 3-step action plan offered with love. First, have the health conversation. Approach it gently. Suggest shared testing, not out of suspicion, but partnership and care. Twice a year nurtures lasting harmony. Second, notice without judgment. If something feels different, suggest a refreshing shared shower. Encourage hydration or support her visit to the doctor. Approach as one unified heart. Third, practice acceptance daily. Think of yourself as honoring her uniqueness, not her flaws. Her fluids aren't dirt. They're vital signs of readiness and mutual trust. I know this topic might stir shame in some hearts. That's natural, and it's held with compassion. But let me gently assure you, you are not alone. Every man I've consulted has asked these same questions. Every couple has carried these same worries. And when they speak with honesty and care, their intimacy doesn't just survive, it blossoms into something eternal. Remember, safety doesn't extinguish romance. It ignites unbreakable trust, and trust sustains passion across decades. Gentlemen, here's the final grace. Passion doesn't retire. Your 60s, 70s, even your 80s can be your most connected, trusting chapters. If you release shame, embrace acceptance, and nurture your health as one. Step away from risky shortcuts or dangerous aids. Care for your body. Speak openly with your beloved. and welcome intimacy with open arms. If these words touched your soul, please like this video, subscribe, and share it with a man who needs this light. Tell me in the comments where you're watching from and what you'd like us to explore next. Small, loving changes can restore freedom, comfort, and trust to your life. Passion never ends, neither does your soul. Thank you for being here, and always remember to take care of yourself because you're worth it.